A 62-year-old female with history of chronic dyspnea and on and off for about 6 years and last exacerbation about 1 year ago. She presented with complaint of fever, shortness of breath and cough for 5 days. Cough was productive of, you can see the thick tenacious sputum, it was foul smelling and it was getting produced in copious amount. And you can see she had clubbing of his bilateral hands and you can see the x-ray. You can see the dilated bronchus in bilateral lung fields involving whole right lung and lower zone of left lung. So what can be the cause of this?